So quickly, guys, you'll be looking at a table, and that table actually contains almost all the pathogens that can be able to cause sexually transmitted infections, as STIs. Okay, so it's just like a summary, okay, of all sexually transmitted diseases or infections. All right, that you guys need to actually know at this particular point. Okay, so you see the table here. This is a table here, but um, we having series of what introduction to this concept, right? So you could see this, you see this causative agents of genital infections. That's basically still sexually transmitted diseases. You have things like the gonococcus, you have the Treponema pallidum, we have the genital herpes, you have the cytomegalovirus, we have the Gardnerella vaginalis, we have Candida, that's yeast, we have what the Trichomonas and the Chlamydia. But even when we start the lecture, if I actually like talk about anyone that I know the picture is right here, we'll just come back and look at it. Okay, so let's look at the introduction to sexually transmitted diseases before we look at that table. In sexually transmitted diseases, the groups at higher risk include what people in the adolescent stage, people who practice what homosexuality, then intravenous drug users. All right, intravenous drug users because okay, somebody might have this sexually transmitted disease right in their blood. Now, because you need blood, and sometimes you might need blood, and it might be an emergency. So they just have to just find anybody that has your same type of what blood group. And sometimes these people might actually have this sexually transmitted disease, but they might be looking so healthy. Do you understand? That sometimes the health practitioners might be tempted not to test their blood for any disease and they just give you this blood, all right? And you might actually take up this. So this sexually transmitted disease in children are rare unless they acquired it during birth. Okay, during birth, that means what the mother actually has this sexually transmitted disease and actually what gave them to the child. Like for example, HIV/AIDS and what do they call it? Congenital syphilis. All right, and also if these children were actually sexually abused, they might have this STI. All right, so transmission of STI, since it's sexually transmitted, it requires a direct person-to-person contact. Of course, the baby is having contact with the mom, all right? Then in adults, you know that definitely having sex, so they're having contact, okay? So it requires direct person-to-person contact because the pathogens do not survive in the environment, okay? So you can't say that there's sexually transmitted disease on this table, you can't pick it, all right? Not like that. So transmission often occurs from what asymptomatic patients. Some people, they might not even show any signs of being sick, all right? And that's what we actually would tempt you to just have sex with them without protection and all the stuff, right? Even sex with protection, there's no 100% assurance that you won't actually have the disease condition. So infection with one sexually transmitted infection associated organism increases the risk of what additional sexually transmitted infections, right? So this just simply means that okay, if you have one sexually transmitted infection, it can actually weaken your immune system and make you prone to having more. Okay, then sexually transmitted infections in pregnancy can be spread to the fetus either in utero or at delivery. Okay, sometimes these children might actually escape this. All right, being 9 months in the mother, they still escape this. But on being given birth to, their blood, you know, there is rupture and all the stuff. So their blood can actually what mix up with the mom's own, right? So that's it. Okay, so you see some of these common organisms that will cause sexually transmitted infections. All right, so let's look at the table. For the viruses, okay, we'll just do it quickly as you can. All right, so you see the herpes simplex virus. All right, herpes simplex virus can cause what disease condition in both males and females. And what is a disease condition? We have the primary and the recurrent herpes. Then we have the neonatal herpes too. All right, so let's look at the herpes simplex virus, human herpes virus. This is it. Okay. Herpes simplex virus is the same thing as human herpes virus. Okay. Let me look at this. Okay, so that's it. Let's move to the next one. Hepatitis B virus. It can cause disease condition in both males and females. And what is the disease condition? That's hepatitis. Right? So you can see hepatitis B virus. This is how it looks like. Okay. Then we have the human papillomavirus. In males, it causes what? Cancer of the penis. In females, it causes what? Cervical dysplasia and cancer. It can also cause what? Vulvar cancer. All right. Then a common medical condition that it causes in both sexes is what we call the condyloma acuminatum. All right. The human papilloma virus. This is how the human papilloma virus looks like. Okay. So moving now. Okay, I think this was herpes. Herpes is quite different from the human herpes virus. Okay. So moving now, going to the human immunodeficiency virus as a HIV virus. It causes what? Acquired immunodeficiency syndrome. That's AIDS. Okay. Human immunodeficiency virus will cause AIDS. Where's human immunodeficiency virus? This is it here. Okay. So I think we have everything in this lecture. Then under the this was under viruses. Okay. Then under the Chlamydia trachomatis. In the males, it can cause urethritis. That's like inflammation of the urethra. It can also cause what? Epididymitis. That's what? Inflammation of the epididymis. Then it can also cause what? Proctitis. Okay. Then in females, it can cause urethral syndrome. It can cause what? Cervicitis. It can also cause what? Bartholinitis. That's inflammation of the Bartholin glands. All right. Then it can also cause salpingitis. It can also cause what? Sequelae. All right. Then in both sexes, like a disease condition that it can cause in both sexes, we have the lymphogranuloma venereum. Okay. Then going to the mycoplasias. Mycoplasias, we have what? Ureplasma what? Uraliticum. Ureplasma uraliticum. And this type of organism can only cause what? Disease condition only in males, and that's the what? Urethritis, inflammation of the urethra. Then going to the bacteria, we have the Neisseria gonorrhoeae. From the name, you know that this is what the causative organism for gonorrhea. Okay, so Neisseria gonorrhoeae, you have it here. Neisseria gonorrhoeae. Nah, I ain't got it. No, I ain't got it. Right, but this Neisseria gonorrhoeae, I have a lecture on it already. Okay, in the males, it causes what? Epididymitis. That's what? Inflammation of the epididymis. It can also cause what? Prostatitis. That's inflammation of the prostate gland. All right. So most of these things, you just know that okay, they are in the males, they are not in the females. So once you know their anatomy, that's all. You are good to go. All right. They can also cause what? Urethral stricture. All right. In females, it can cause what? Cervicitis. It can cause endometritis. It can cause what? Bartholinitis. It can cause salpingitis. It can cause sequelae. That's what sequelae is just simply infertility, or even if the woman is fertilized, the type of pregnancy she will have is an ectopic pregnancy. That's one. An atypical pregnancy. Then there will be recurrent what? Salpingitis. All right. Then in both sexes, it can cause urethritis, it can cause proctitis, it can cause pharyngitis, it can cause disseminated gonococcal infection. Then still under the bacteria, we have bacteria like what? Treponema pallidum. This one can cause disease condition in both sexes, and that disease condition is what we call the syphilis. We have the Haemophilus ducreyi. All right. Haemophilus ducreyi can cause what? Chancroid. All right. Then we have what? The Klebsiella what? Granulomatis. The Klebsiella granulomatis can cause what? Granuloma what? Inguinale. All right. Then going to the protozoa, we just have one example on that protozoa. we have the Trichomonas what vaginalis. All right. So Trichomonas what vaginalis in males can cause what urethritis. That's inflammation of the urethra. It can also cause what balanitis. All right. Then in females, this organism can cause what we call the vaginitis. Okay. So I just ending up with sweet pictures about these niggas. All right. See, like this is what gonorrhea. That's what Neisseria gonorrhoeae. Hepatitis B, we've already looked at it. Uh, Trichomonas. This is what Trichomonas vaginalis. All right, and it can cause what Tri- trichomoniasis. All right, we have looked at HIV. We have looked at the Herpes simplex virus. We have looked at the causative organism for syphilis. That's what Treponema pallidum. Okay, so that's causative enzyme, causative what organism for syphilis. Then chlamydia trachomatis. All right, chlamydia trachomatis. This is what that's the word causative organism for all these conditions. All right, under males, females, and all right for both. Okay, so that's it, guys, and that's it about what pathogens of sexually transmitted infections. See you guys pretty soon.